Hello everybody. Welcome to Number 1 Doctor channel. Today video is about, which is part of our playlist called Short Medical Notes, in which we will have short videos about important topic in medicine. But please do not forget to like, share our videos, subscribe to our YouTube channel Number 1 Doctor, and join our social media accounts in the links below each video. Our aim is to share the correct medical knowledge for all for free. Share and be shared. Today we will talk about surgical infections. Infections often occur as an aftermath of the violation of the integrity of the human body, such as trauma. They obviously can also occur as a consequence of disease, for instance, perforation of the colon with subsequent spillage of bacteria into the peritoneal cavity. Many general principles apply to both situations. Let us review them. When harmful organisms invade our tissues, the ultimate outcome depends on the balance between the virulence of the bugs and the robustness of the body's natural defenses. The principal factor on the side of the invaders is their number. A wound sustained on a battlefield, for instance, starts with a huge inoculum. The second factor in microbes' favor is time. Bacteria in an environment with ideal nutrients, humidity, and temperature multiply at an astonishing speed. Thus, what might begin as a minor contamination such as a stab wound in a clean setting will eventually become a real problem if not promptly treated. The magic time for that undesirable development is around 6 hours. On the side of patient, the main defense is the richness of the blood supply at the site of the battle. Well-supplied sites like the face and the soft tissues of the oral cavity get infected very rarely. At the other end of the spectrum are bones, cartilage, and previously irradiated tissues. The bugs typically win there, sometimes helped by systemic conditions like an immunosuppressed state or diabetes. So, what can we do to help the patient? Bearing in mind what we have reviewed so far, several strategies should be obvious. Let's start with time. Don't allow those evil bugs to multiply inside the human victim. An individual with a perforated colon or a broken femur sticking out of a dirty wound deserves priority in the scheduling of available operating rooms. Simple mechanical cleansing in the OR will diminish the number of invaders. The first order of business is elimination of foreign material and dead tissue, along with massive irrigation. Dilution is the solution to the problem of pollution. Next, let's look at blood supply. Given its importance, wouldn't it be nice to increase it to tilt the balance in favor of the patient? We can do it with an old trick that is cheap and easy to apply. Consider subcutaneous tissue, another poorly irrigated area of the body. If we close a heavily contaminated wound, that fatty layer will predictably become an abscess. But if we leave it open, the healing process covers that exposed fat with granulation tissue, which is made up of vascular buds. Medical students are often bewildered at the end of an operation for a perforated colon when the surgeon tells the chief resident, leave the wound open. They have visions of bowel spilling out and flies landing for a drink of blood. What the chief is actually communicating is close everything up to and including the fascia, but leave the subcutaneous tissue and skin open. Several days later, when granulation tissue is well established, we can close that wound with impunity. More recently, we have discovered another way to keep wounds clean: suction. Constant, gentle suction applied by patented mechanical devices has become a common adjuvant in the management of these patients. What about antibiotics? Aren't they our most potent weapons to kill bacteria? Yes, antibiotics have a role, but they are not a substitute for the universally applicable measures already discussed. There is no universal antibiotic, no single drug or drug combination that can wipe out all harmful bugs. It is beyond the scope of this little book to engage in a detailed discussion of antibiotic choices. More than 150 options are available, and mastery of that topic requires a 2-year fellowship beyond basic residency training. We will just mention a couple of examples. Colonic contents represent one end of the spectrum, requiring a combination of agents to cover gram-positive, gram-negative, and anaerobic organisms. Some practitioners use ciprofloxacin and metronidazole in the management of lower GI injury or disease, while some prefer piperacillin and tazobactam and others include imipenem. Skin flora, on the other hand, is typically handled with a single drug. When you first venture into the operating room for a clean, elective case, you will find that surgeons want the patient to have good blood levels of cefazolin during the operation. To ensure this, they administer it 2 hours prior to making the incision. Many of the rituals of surgery are, in fact, based on the principles that we have just discussed. Because morning hours are very busy in the surgical suite, we used to shave the operating area the night before. No longer. Razor blades can nick the skin and allow bacteria in. Given 12 hours in a warm, moist, nutrient-rich environment, what do those little creatures do? You know, they multiply like crazy. So, now we get rid of the hair just before we prep the area, and we do it with clippers. Thanks for watching our video and hope to see you again in next videos. Do not forget to see other videos in our channel. With my best wishes. Dr. Atef Ahmed. Best wishes.